Okay, so we'll have a hand. We'll just hand it
The distinguished mental health expert, Professor J. Yasari, whom along the years have worked with him in several areas, and also Dr. Kensegu, who is also a very distinguished public health practitioner who crossed my path severally whilst in public service. I salute you for your dedication and commitment to Mother Ghana. Distinguished ladies and gentlemen, my colleagues from the Office of the Vice President, our friends from the media, members of the clergy, ladies and gentlemen, it is a profound honor and privilege to stand before you this morning to represent Her Excellency the Vice President of the Republic of Ghana, Professor Naana at this important national occasion to launch this year's Mental Health Awareness Month, also known as Purple Month. I bring you her warm greetings, unwavering solidarity, and heartfelt commitment to the cause that gathers us here today. This year's theme, Mental Wellness, My Voice Matters, resonates deeply with the values and principles of Her Excellency the Vice President, Professor Naana. It is not merely a theme, it's a rallying cry, a declaration of inclusion, and a reaffirmation of the fundamental human rights to be seen, to be heard, and to be supported. It urges us all to listen more attentively, to act more compassionately, to commit more deliberately to the collective well-being of our nation. For far too long, mental health in Ghana, and indeed across much of the world, has been misunderstood, under-discussed, and under-resourced. It has existed in the shadows of health discourse, buried beneath layers of stigma, fear, and silence. We have knowingly or unknowingly allowed outdated perceptions and cultural taboos to shape our national conversation around mental wellness. As a result, too many of our fellow citizens, our brothers and sisters, children, neighbors, continue to suffer in silence, afraid to speak up and unable to seek help. This silence is not benign, but dangerous and costly. It is robbing us of lives filled with promise, draining the vitality of our youth, eroding the potential of our workforce, and inflicting emotional, social, and economic damage on our communities. Today and throughout this month, we must renew our determination to end this and end that silence. We are here to reaffirm unequivocally that mental health is an integral and indispensable part of our overall health and well-being. It is not secondary or optional. It deserves to be spoken about in the open with dignity, compassion, and urgency. Every Ghanaian deserves the right to live with peace of mind, emotional stability, and access to support systems that care for both the body and the mind. In recent years, we have seen troubling increase in mental health conditions in our country. Depression, anxiety, stress-related disorders, and substance use disorders have become more prevalent. By some estimates, rising by over 20% in just the past 2 years. And yet, these numbers still do not reflect the full scale of the problem. Because countless individuals remain unaccounted either because they do not seek help out of fear of being judged or shamed, or because the services they need are simply out of reach. Mental illness does not discriminate. It does not care whether one is younger or old, male or female, rich or poor, rural or urban. It can affect anyone, anywhere, and at any time. And that truth should unite us not in fear, but in action. As Her Excellency, the Vice President of the Republic of Ghana, Professor Naana, has consistently emphasized, we must create a society where mental health is not hidden behind closed doors, but embraced in our communities, our policies, and our priorities. We must foster a national culture where vulnerability is not seen as weakness, but as courage, where asking for help is not frowned upon, but applauded, and where every citizen feels empowered to speak openly about their mental well-being. Indeed, the government of Ghana is committed to this cause under the leadership of His Excellency John Dramani Mahama and Professor Naana. Efforts are underway to make mental health care more accessible, more affordable, and more integrated into our national health agenda. This includes strengthening the infrastructure of our mental health facilities, expanding community-based services, and supporting the Mental Health Authority in their critical mission. However, government cannot do this alone. Real and lasting change must be driven by all of us, by civil society, health professionals, educators, religious leaders, the media, traditional authorities, families, and individuals. We each have a role to play, a voice to raise, a hand to extend. We must educate ourselves and those around us to better understand mental health. We must speak up when we see someone struggling. We must create a safe space where those facing mental health challenges are met with empathy rather than judgment. And we must stand in solidarity with those voices whose voices have been silenced for far too long. This moment, distinguished ladies and gentlemen, is quite significant. A chance for us to turn awareness into action and concern into commitment. Let us use this moment to inspire real change in our homes, our workplaces, our classrooms, and our public institutions. Let me leave you, ladies and gentlemen, with these words of Her Excellency, the Vice President. Your voice matters. Your story matters. Our collective well-being matters. Let us lift our voices together so that no Ghanaian feels alone in their struggle. Let us be generational. Let us be generation that breaks the stigma, that prioritizes mental wellness, and that affirms every individual's right to live a life of dignity, hope, and support. Together, let us build a Ghana where mental health is not a hidden issue, but a visible national priority. A Ghana where compassion leads, stigma ends, and wellness thrives. On this note, let me take this opportunity on behalf of Her Excellency, the Vice President of the Republic of Ghana, to formally declare the National Mental Health Awareness Month, otherwise known as Purple Month, duly launched. Thank you, and God bless you.
For support from and inclusion in district assemblies. Of course, it's not just having a voice, but being listened to and having your voice valued that matters. And that is why the programme also worked to reduce stigma and discrimination. And I think the power of this is really demonstrated by what a woman with a psychosocial disability in Volta region said after being supported by one of our partners, Voice Garden. She said, "I now feel excited and proud when community members are referring to me as auntie or sister or madam or even mum in place of mad person, as they used to call me before." Mental health can affect anyone. Statistically, 1 in 4 of us will experience a mental health problem in any given year. So let's use this month to create the environment where everyone can speak up on mental health without fear of discrimination, whether as a person with lived experience, an ally, an advocate, or simply common community. And then let's sustain that beyond this Purple Month so that everyone's voice matters every day of the year. Thank you.
Dedicated to raising awareness and deepening national conversations around mental health in Ghana. Mental health is a vital pillar for our overall well-being. It shapes how we think, feel, relate to others, and handle life challenges. Yet, for far too long, mental health has been shrouded in silence, stigmatized, and overlooked in our country. Many of our brothers and sisters have suffered in silence, afraid to seek help, fearful of judgment, and often isolated from the support they need. This culture of silence has caused untold suffering and, in some tragic cases, irreversible consequences. The theme for this year's Purple Month, and I quote, "Mental Well-Being, My Voice Matters," is both timely and powerful. It is a rallying call to every Ghanaian to speak up, break the silence, and demand that mental well-being is treated with the same urgency and respect as physical health. It reminds us that every voice matters, and that true progress begins when we center the voices of these living with mental health challenges. As a government, we are guided by a clear vision and a bold set of commitments outlined in the 2024 NDC manifesto under the leadership of His Excellency John Dramani Mahama. Mental health is a priority, and not just in word, but in action. Ladies and gentlemen, I am pleased to reaffirm today some of the core mental health commitments we made in the 2024 manifesto. First, we will review and integrate mental health services into primary health care so that care is brought closer to our communities and become a routine part of health-seeking behavior. Second, we will commence the establishment of modern mental health hospitals in the northern part of the country and refurbish existing mental health facilities to ensure equity in access to care. The third point is that we will adequately resource the Accra and Pantan Psychiatric Hospital, enabling them to deliver more effective, responsive, and comprehensive mental health services. Fourth, We will review the Mental Health Authority Act to support the expansion of training, recruitment, and retention of community mental officers, health officers, who are vital to extending care into underserved areas. And the fifth one, we will establish mental health hotlines, as has already been mentioned by the Chief Executive, under the National Health Insurance Framework, allowing Ghanaians to access professional support and e-counseling services at the district level when they need it most. Ladies and gentlemen, these interventions taken together are aimed at building a mental health system that is accessible, inclusive, integrated, and fit for purpose. But beyond infrastructure and policy, we also recognize the need for a national culture shift, one that encourages openness, empathy, and understanding. That is why I call on all of us, traditional and faith leaders, civil society organizations, the media, private sector partners, and every citizen to be champions for mental health in our communities. Let us stand together to dismantle stigma, support those in need, and make mental well-being a true national priority. Ladies and gentlemen, Purple Month is more than an event. It is a movement. I commend the Mental Health Authority for their leadership and tireless dedication to this cause. To all Ghanaians, I urge you to just listen without judgment and respond with compassion. Together, we can break the silence. Together, we can end the stigma. And together, we can make mental well-being a reality of every Ghanaian. Thank you, and may God bless all.
Good morning to you, distinguished Judge, Chairperson, the Minister for Health, the CEO of Mental Health Authority, the media, invited guests, ladies and gentlemen. I'm Dr. Lawrence Oforibo, the Director responsible for clinical care in Ghana Health Service. I'm here representing the Acting Director General, Professor Ba, who was supposed to be here, but this morning called for me to step in because he's attending to an emergency call. I bring you greetings from the Ghana Health Service, the Director General, who is taking key interest in mental health activity for the year 2025. So the service commends Mental Health Authority for dedicating the month of May as Purple Month, a time to raise awareness and promote mental health across Ghana. This year's theme, Mental Wellbeing, My Voice Matters, encourages us all to listen to every voice, whether from the people with personal experience of mental illness, caregivers, professionals, or public, because every voice matters. Sadly, mental health illness is still heavily stigmatized in Ghana. Many people are afraid to talk about their struggles to seek help because of fear, shame, and discrimination. This silence makes it very difficult to get the care that they need. The theme for this year reminds us of our need to be heard, especially those affected by mental health conditions. As a service, we stand with Mental Health Authority, stakeholders, and all partners to highlight the importance of mental health, which is closely linked to our physical health. Mental health challenges affect all people and all walks of life, and they have impacts on families, communities, and the nation at large. The month of May is also a month that we hold very much importance in mental health by emphasizing on Maternal and Mental Health Week. That is on 1st May, and also Schizophrenia Awareness Day. That's on 24th May. And these events help us to pay particular attention to the mental health needs of our staff as well as the population. Another growing concern that the service has identified among the youth is the red menace, the misuse of drugs like tramadol, cocaine, cannabis, and other drugs that has serious problems on their mental health and give them drug-related psychosis, school dropouts, crimes, and even death. We must act now to protect our youth and our future. Throughout the month of May, Ghana Health Service is supporting the activities across all our 16 regions to spread awareness about mental health. Health workers are encouraged in every region to speak to clients in health facilities, especially those attending our outpatient clinics, and also reach out to schools, churches, mosques, and the community with these key messages of our celebration. In addition, the service is also building capacity for our staff, especially those who are general practitioners, to help identify, support, and manage mental health conditions that come to our facilities. We also strengthen mental health activities in schools and workplace by screening our colleagues first, who are health workers, and also identifying people who need help for mental health experts. As part of our long-term strategy, the service is also enrolling what we call employee assistance program for a full implementation of the system so that our staff who have challenges can be attended to by specialists in the mental health arena, which is being led by clinical psychologists. We are also working together with Mental Health Authority and civil society groups, the media, to share mental health information on both social media and traditional media. Respectful Chairperson, the Minister for Health, CEO of Mental Health Authority, we encourage everyone facing psychological, emotional, or mental health to visit our nearest facility from the chief level health centers, district hospitals, regional hospitals, where we have trained veterinarians at least to identify your challenge and refer you appropriately. Ghana Health Service remain committed to making mental health care accessible and to creating a society where people feel safe in their work environment and also feel safe to take care of those who are in need. Thank you very much.
We recognize that ensuring access to mental health care is critical to building a healthier and stronger community. And that is why the National Health Insurance Scheme has considered coverage of some mental health conditions, namely depression, bipolar disorder, anxiety, and schizophrenia. Our aim is simple, that no one should be denied care they need because of financial barriers. The NHI is currently at the final stages of completing the tariffs to fully operationalize these inclusions in the NHI's benefit package. Through continued collaboration with the Mental Health Authority and other partners, we are working to strengthen access, widen our coverage, and ensure that mental health services are not just available, but affordable and responsive to the needs of every Ghanaian. As we begin this important month, let us all pledge to advocate for mental health, listen more, judge less, and support one another with compassion and understanding. Together we can build a future where mental health is a national priority and where no one is left behind. Before I take my seat, ladies and gentlemen, may I respectfully inform you that the NHI has set up a desk just outside of this door so that we'll all be able to activate our membership for those who need theirs renewed and for those who want to register for the very first time. We don't want to leave anyone behind, so access to your doorstep. Thank you very much, and I wish all of us a meaningful and impactful Mental Health Awareness Month. Thank you.